Hi, I'm Susan Lephart from the University of Kentucky Healthcare Center. I'm presenting my work today on animal-assisted therapy and its effects on some of the medical students at University of Kentucky Medical School. My fellow collaborators are Dr. Connie Jennings, Dr. Andrew Holine, and Ms. Ashley Nicole Hamilton, and I'd like to thank them for their participation in this project. So the project itself was really just looking at whether or not the stress levels of our medical students might be reduced by an interaction with animal-assisted therapy dogs. Our therapy dogs would come for 30 minutes before the students would go in and take their exams, and the students would choose to interact. They didn't have to, but they would choose to interact with the dogs before they would go in to begin the exam period. We would do this for 4 periods when they had an exam, and then we'd have 4 more when they did not interact with the dogs before exams, and we surveyed them after each time. Most of the time, what we found in the results was that the students really saw a reduction in their perceived stress and anxiety, which you can see with this chart right here. When they did not have the dogs come, we also surveyed them, and the things that they showed at that period of time is that their stress levels were really producing themselves in forms of fear, in forms of sadness, as well as guilt and stress. So from these derivatives from here, we saw that the levels sometimes were almost as high as suicidal, particularly in the levels of sadness and fear, which for us is very concerning. So just as a basic rule, some of these other things that we asked in the survey after they had seen the dogs, we got very positive feedback from them relative to feeling supported by the medical school itself, feeling as though they might want to use animal-assisted therapy in their practice moving forward, and some other beneficial feedback from that. The next steps that we plan to take are to have the students reveal some of their test scores anonymously so that we can take those and use those collaboratively with the surveys. And then the third step will be to measure cortisol levels as well so that we have a physiological measurement of the stress level. Thank you so much. I hope that you keep up with our research.